Good morning, Dr. Shah. Can you tell us more about your personal journey towards a vegan diet?
I've been always looking into the Jainism and based on the animal sympathy. And the book that I read really that impressed me the most was the book written by the John Robbins, The Diet for New America. And one of my patients came and offered to me because he himself was in a pesticide business and he developed multiple sclerosis and he did his own journey, explored into this book, and then finally gave me the gift of that book. But the book, he told me that this is what you've been telling us, Dr. Shah, all along anyway, but I'm gonna give you the book regardless, because and then so far all my beliefs were based on Jainism, to not to have any kind of violence to the animals, and I had done my own research how the cows are being raised. So I definitely had my own ideas and definitely my opinions about all of this. But by reading the book, I got the scientific kind of a sense of authority to what I was believing all along. And then I have promoted that particular book also. And veganism itself, I have promoted heavily into my practice itself. But over the period of years, I have come across some surprising patients that has led me to believe that the veganism is the only solution for the planet Earth, and really for the for the upbringing of uplifting of your soul, because that's really the cleanest diet you can have. One of my patient came to me like after driving 3.5 hours, came to see me and for something else like bronchitis or something, but she happened to say that, oh, by the way, my cholesterol is also high. It's like 276, and my doctors want me to go on medications, and they say the diets don't work. I said, no, my philosophy is anything that can run away from you, you should let it run. So he says, so overnight she became vegan, and believe it or not, in 6 weeks she texted me. She said that my cholesterol dropped to 170 in 6 weeks. And I was really, at this point, I was really amazed also, and also very happy that what vegan diet did for her. So since then I've been recommending vegan diet to almost everyone, to my patients, and for various reasons, and mainly for the health, because that's the field that I am in, but on top of that for ethical and moral reasons.
So, Dr. Shah, can you tell us how long you've been in practice and a little bit about the scope of your practice?
I'm in practice about 26 years, so 26, 27 years. A lot of, I've been practicing in a suburban area in New Jersey, and I have a lot of Indian clientele as well as American clientele, so I have really experience on both sides. And lately my practice has been geared more towards promoting veganism in our diet, in our daily life, and mainly because I have seen a lot of health benefits. So I have seen myself implementing the healthful benefits of the veganism, and I take care of several age groups, younger people I have seen, and elderly people I see. Trying to promote veganism has been a challenge a lot of times. The younger patients I have seen are more adaptive, even though they are Indians or Americans. The younger people have more vitality, they have more desires to change their life, versus elderly people who have been set kind of in their own lifestyle and the dietary lifestyle that they've been living in. So, but I mean well for everybody, so I definitely try to implement even to the non-Indian patients. Besides the benefit of veganism on the cholesterols and things like that, I have seen a lot of weight reduction in a lot of people. Sometimes what happens is people lose weight a little too fast, so they start getting worried that there's something wrong with them, and they get kind of tormented by their surroundings, their colleagues and friends, that, oh, you're losing weight too much too fast, this is not healthy, and they revert back to taking the dairy products, not realizing that the weight loss that was coming from the veganism was a healthy weight loss. On top of that, so when that happens, I tell them to get into more exercise program so they don't get too weak, and also tell them to eat more nuts, which gives them sufficient amount of energy, and it is still plant-based. So all these benefits I have seen, and I do tell them to take vitamin B12, if the B12 levels become low, So yes, there are some implications that can be there, but that they're easy to overcome, and they're not that much of a challenge.
Tell us about your observations with the patients, and you might have any plans to, whether you might have any plans to present those.
Uh, Happily saying that last 6 to 8 months has really kind of revolutionized my practice, and I'm gearing heavily towards veganism for total health benefit, and of course keeping the health of the planet in general, but focusing especially in my small clinical settings. I have collected data on about 50 to 60 patients so far who have clearly shown the benefit, uh, where they have dropped their LDLs, especially, which is the molecule ultimately responsible for the coronary artery disease risk. And if you really look at the aggregate data of all the statins combined, it shows the drop of about 29.9% from the use of statins. But in my practice, the veganism itself has yielded results anywhere from 10 to 50% drop in their LDLs. Depends upon their lifestyle. If their lifestyle was heavily geared towards the animal products, they have shown 50 up to 50% drop. People who were only vegetarians, they still have dropped anywhere from 10 to 30%. So at this point, I'm thinking that where is the problem? If the society is adding the cholesterol load and then giving the statins to reduce that cholesterol load, is just not practical. I think prevention is the best way to eradicate all these diseases from the face of the earth, and get the people into a healthier mode. Also, I have noticed that people have lost significant weights also, so that has been a significant benefit. And because of these settings that I have seen, I'm thinking of using this data to present a grand rounds at my local hospitals, and I might even write up a small article of one clinician's experience with the use of veganism and the effect on the cholesterol and the health in general.
Have you seen any differences in the willingness to change among Indian patients or Jain patients versus American patients of yours?
I have seen people are resistant in general, period, because of the myth that has been fed into the people's mind that milk is healthy, dairy products are healthy, and meat is absolutely must for you to sustain your stamina and energy. So all those myths are not easy to remove, but overall my experience has been that American patients are more, or rather non-Indian patients are more kind of approachable, more easy to understand, and more easy to become adaptable to change their lifestyle to stick to some kind of diet that you tell them to try. At least they will give it a try. Versus I have seen in the Indian patients, I have seen younger patients are more amenable to change rather than elderly people, because they have grown up in the Indian society thinking that the milk is healthy for you, and then so there it's kind of becoming difficult at some point to talk to the elderly people.
Especially the vegetarians, the people that are already vegetarian?
Right, exactly. They think that being a vegetarian is healthy, so there is no more need to change.
Yeah.
And we grew up this way, so the milk has been part of our life.
Right.
Versus the American patients they have no exposure to any of these things, so they're ready to make a change. I think, personally speaking, their minds are more open for a change. But at the same time, a lot of younger Indian population I have seen, they're also willing to change. And if I give them the facts,
Yeah.
and they tell them, and I have computers in my every room, and I show them the data, what milk has been doing, and I have the graphs that I can present to them, and they're really easy to understand, and they're easy to change.
That's great.
More often than not, I have seen that people who actually been diagnosed with a diabetic type of diagnosis, and especially now the government regulations have created the new category of pre-diabetes. So a lot of people are being labeled as pre-diabetic just to make them aware of their unhealthy lifestyles. So when that happens, a lot of younger people, especially because these are the people in 30s and 40s, they are being diagnosed with the pre-diabetic conditions, and at that time, if I talk to them about veganism, they're ready to make a change in their lifestyle. Absolutely.